Our next panelist, however, is a wonderful man who doesn't need much introduction to those of us who have been in the healthcare field in Rhode Island for any length of time. He was my most elusive panelist, and I chased him for a number of days before we got him pinned down, thanks to Steve DeToy of the Rhode Island Medical Society. But we're glad we got him, and he's here. It is my great pleasure to introduce you our next guest, who is a physician specializing in occupational medicine and the senior area medical director for the United States Postal Service in New England and New York. Dr. Chungus is the past president of the Rhode Island Medical Society, and he served 4 terms in the Rhode Island General Assembly, where he was responsible for the passage of the Childhood Lead Poisoning Prevention Act, the Rhode Island Living Will legislation, and establishing Right Care, the Child and Family Health Insurance Program. He currently serves as chairman of Health Right, a coalition of business, labor, medical, professional, and consumer groups working to reform the state health care system. He is a doctor, he is an activist, he is a wonderful gentleman, and it's an honor to introduce Dr. Nick Chungus.
I think I should stop right there. Thank you, Kathleen and Dr. Regine, for the invitation. And I forget, Kathleen, whether it was 23 years ago this month or 25 years ago this month, you and I were knocking on doors on the east side of Providence. Either fortunately or unfortunately, I remember the time one of the positions I was taking was health insurance for everyone. And unfortunately, it's taken this long. I hope it's only this long that it takes. I was visited last weekend by my parents. I was surprised when we brought up the issue of healthcare reform that they responded with fear. And they told me to take my sign down, or that I ought to consider it. And it's unfortunate that it's come to that point. But I do want to make sure that no one leaves today without recognizing that there's a lot to fear. That people on Medicare have something to fear. People who have Medicare supplemental have something to fear. People on Medicaid and Right Care have something to fear. People who get their health insurance from their employer have a lot to fear. People who pay for their health insurance out of their own pocket have a lot to fear. What they should be afraid of is that we do nothing. Because if we do nothing, we can no longer be able to afford this healthcare delivery system as it stands. The issue of the uninsured is a symptom of what's sick with everyone else's healthcare. The uninsured numbers increase for the same reason that everyone else's health insurance is at risk, because healthcare inflation has not been controlled. And until we reorder how we deliver healthcare, until we are able to control healthcare inflation, we are all at risk. That is the motivation for reform. You all know what Churchill said about Americans always doing the right thing when they've tried everything else. When there is no other option left. And I think that's where we've arrived. Everyone, and I tell this to each of our stakeholders in our Health Right organization, which is made up of small business people, of labor unions, of physicians and nurses, of consumer people, that we all own this system to some degree. If there's something wrong with it, we are all somewhat responsible for what's wrong with it. And that we all need to be able to recognize that we have to sacrifice something to get to the point where it serves us better. And that means doctors too. And we can get into the detail of what that means for physicians. But I'm pleased to be here, and I hope that and I trust that the conversation is going to be very, very rigorous. Thank you.
you, Dr. Chungus.